else you need to look at to keep it from happening again.
You ask them what they want to do, what are their goals?
You can ask them what their goals are.
You can ask if this has never happened before. Is this like a repeat injury that keeps happening?
Yeah. Okay. So there's lots and lots and lots of questions that you can ask. One of the things that you want to be careful of in this case is you're not really digging for a complete medical history. Okay? This is just, really try to keep it, short and sweet, because you could spend half an hour just talking about stuff. You blow all your time talking about stuff, you're not going to get your skills done. And this is the important, really important part. Okay?
So can you just go ahead and do the assessment first, and then after you finish the okay, now let's go ahead and talk about all of that. So you kind of gauge
You
that?
can. I tell you what though, I like to get some of that information up
Yeah.
front, because what it does is it helps you build rapport with the patient.
Right.
It gives them the idea that you really care what happened to them, and you care what's going to happen to them.
Yeah. Ideally, like I would
If you do
try
that,
and ask it while I was
if you,
doing
yeah,
stuff,
yeah,
but
yeah,
then you
yeah.
get,
Well, and sometimes you do that. Sometimes you do that. But it's good to, just sit down and have a little short chat with them at first, just to develop rapport so that they trust you and they know that you're not going to hurt them. That you're there for their best interest, right? Yeah.
Been there, done that.
Got the t-shirt now.
Yeah.
Okay. One of the things I will tell you is I'm going to remind you that your range of motions need to be ranges of motion. 0 to 140, 0 to whatever it is, or if it's an elbow, it might not be full extension. Might be full flexion, but not full extension, so it's 20 to 140. Okay? All of your range of motions have to be expressed as a range, a number range. So if you want to put, for your range of motions, if you wanted to highlight this whole box and put blank to blank, so that you're reminded to do that, do it. Okay? Your manual muscle testing needs to be something over 5. Okay? Put that in your form so that you are reminded to do that. You know what I'm saying? 3 over 5, 4 over 5, 2 over 5, whatever it is. It's going to be something over 5. That's your scale. Okay? All right. Let's take a little break and then